Month 7 of pregnancy means big kicks, new symptoms, and more check-ins. By the end of this video, you will be able to tell Braxton Hicks from real labor, use kick counting with confidence, and then leave your next OB appointment with one personalized action from your provider. My name is Diana. I'm a physician assistant in women's health and a mama to 4. Let's make month 7 calmer and clearer. At the beginning of month 7, your baby is roughly around 2¼ to 3 pounds and about 15 to 16 inches long, which is about the size of a butternut squash. The brain development is amazing. The brain is starting to fold to create more surface area for learning. Their eyes, which were previously fused shut, are now unfused and can open and close, and they are starting to react to light. You might start to notice little rhythmic motions. That's because your little one can get the hiccups. Inside the lungs, their cells are developing something called surfactant. Think of that like a soap lining the little air sacs so that they don't stick closed after birth. Their hearing now is very developed and they can recognize your voice. They can also get startled with loud sounds. They're also starting to develop more fat underneath their skin. As that fat develops, it makes their skin less wrinkly and gives them that more cute, chubby appearance. They are now starting to develop a more recognizable sleep cycle where they have familiar active windows where they move more often and then quieter ones. During the day when you are walking around, that tends to rock them to sleep more often. And then when you lay down at night, that's often when they tend to be a little bit more active. Their taste buds are starting to work now, and interestingly, amniotic fluid changes its flavor with your meals. So whatever you are eating, they're going to be tasting that too. They have developed eyelashes and their nails have grown in too. Now in my month 5 and 6 videos, I talked about something called lanugo, which is that thin layer of hair that develops over their skin. By now that lanugo is starting to shed. One of the purposes of lanugo is to keep the baby warm, but with that fat that's now growing, they don't need it anymore. Now what you're going to notice from the outside is stronger kicks. Now they have less room to move in there, and so their kicks are going to be less jerky and more rolling movements, definitely more intense. You'll also feel them stretch inside your uterus as their space gets tighter the bigger they get. It's important to pay attention to your baby's movements to know when they tend to be more active and when they tend to be a little bit quieter. Now that you are in the 7th month, your medical provider might talk to you about doing something called kick counting. Now kick counting is just a way for you to keep track of how much your baby is moving, and it can alert you if your baby isn't moving as much as they should. So here's how you do kick counting. You choose a time when your baby is normally active, and then you sit or lie down on your left side and count how long it takes for them to get 10 movements. During a normally active time, the baby should move 10 times within 2 hours. If not, call your medical provider. You might think to yourself, well, I feel the baby move 10 times in 10 minutes when I'm up and about, and that's totally fine. If you take note of that each and every day, that's kick counting. But if you notice that the baby hasn't moved when they normally should be moving a lot, that's when you sit down and do an official kick counting. And again, if they haven't moved 10 times in 2 hours, call your medical provider. That's why knowing the baby's sleep and awake cycles is so important. If you try to do kick counting during a time during the day where they are usually quiet and not moving a lot, it might make you think that there's something wrong with the baby, but instead they're just resting. So pay attention, know when your baby normally moves, and then do your kick counting then. Okay, time out real quick because I want to announce something that I'm really excited about. I have just launched a brand new community of pregnant women, and it is for you. It's called Own My Birth, and it's a community of pregnant women and new mamas where you guys can gather together, share your experiences, support one another. I will be there as well. I'll be doing bi-monthly live Q&As and also giving you free printables and videos to help you along that are exclusively for this private community. This community is also where I will be hosting my prenatal and birth prep course called Own My Birth. I'm going to link to this in the video description. Go check it out. Join your community where you will feel support and love from a group of mamas going through exactly what you are going through right now. Okay, now let's jump into pregnancy symptoms and what will actually help you. Because remember, you are growing a human being, and of course you're going to be more tired. So relief is the goal here. So first of all, shortness of breath. Now your uterus is going to be sitting up higher underneath the ribs. That gives you less room for those lungs to take a full breath. but sitting upright really can help. And also make sure to take gentle walks, slow nose breathing, and then sleep on your left side. I found it really helpful to put an extra pillow in between my knees and then also a pillow behind my back. Make sure to talk to your medical provider if you notice any sudden severe shortness of breath or chest pain. If you're struggling with heartburn, smaller meals, earlier dinners, and then elevate the head of your bed when you lay down. If you need to know what medications are safe for you, again, make sure to talk to your medical provider. Next, let's talk about back pain and pelvic pain. Super common in pregnancy because your hormones are causing your ligaments to become softer. Also, your growing belly is putting more weight forward and it's shifting your center of gravity, and so you lean back so that you don't end up falling forward. And again, that can cause back pain. Belly bands were a lifesaver for me. You can use heat and ice in your low back. A pillow between your knees at night can really help. And then pelvic floor physical therapy if that is available to you. Leg cramps. I've talked about leg cramps before, especially in my month 6 video. And I also did an entire video about that, which I will link to up here. But in a nutshell, leg cramps are pretty common. I had them horribly. They woke me up in the middle of the night, especially in my second and my third pregnancy. If you tend to get leg cramps, make sure to stretch your calves before bed. While you're having a leg cramp, flex your foot towards your shin and don't point your toes. Also, hydration can be really helpful. Let's talk about swelling in your feet or ankles. Now, here are my ankles near the end of my 3rd trimester. My kids thought it was so fun to play with my ankles because they could push on a spot and it would stay indented. We call that pitting edema. So compression stockings can really help with swelling. I like the ones that go all the way up to your thighs. Gentle ankle rolls, and then even if it might sound counterintuitive, hydrating really can help with ankle swelling. Make sure to call your medical provider if you have any sudden face or hand swelling, especially with a headache, vision changes, or upper right belly pain. Hemorrhoids. Very common in pregnancy. If you're struggling with that, make sure to take lots of fiber so that your stools are not hard. You tend to be more constipated when you're pregnant because of the prenatal vitamins. The iron in prenatals can cause constipation. So make sure to get lots of fiber to help keep your stools from being too hard. Try not to strain when you're having a bowel movement, and then witch hazel pads can really be soothing. If you need something stronger than that, you can talk to your medical provider about over-the-counter or prescription medications. If you're struggling with sleep, cool, dark, and boring is going to be your answer. I like to do a 1-minute brain dump before I turned off my light, where I would grab my journal and just write down all my thoughts. I would just get it out of my head, down on paper. That helped clear my brain so that I could turn my thoughts off more easily when I was trying to sleep. This next topic I think is really important. I want to talk about the difference between Braxton Hicks, which are practice contractions, and real labor pain. In month 7 of pregnancy, you might start to notice some tightening, squeezing around your abdomen. That can be very normal. It's your body practicing and strengthening those uterine muscles. But if you're not familiar with them, you might start to wonder, am I having a false contraction or am I going into labor? So let's talk about the difference. Braxton Hicks contractions are irregular. They don't get more regular with time. They get better if you get a glass of water and then lay down and rest. Real labor contractions become more consistent over time, stronger over time, and it doesn't matter if you were sitting down or standing up, they continue to get more and more regular. So remember, if your contractions get tight and then they're gone, they're often practice contractions. If they're building and getting worse over time, it's more likely to be labor. Now, if contractions are regular and painful about every 5 minutes apart for an hour before 37 weeks, make sure to call your medical provider. Let's talk about your month 7 visit and what to expect. They're going to check your blood pressure, your weight, your urine dip for protein and glucose. They're going to check at the height of your uterus, called your fundal height, and then the baby's heart rate. And they're probably going to check a quick position estimate to tell if the baby's head is down or up. If they haven't done this yet, they're going to check for gestational diabetes screening. If you are Rh negative, you're likely going to receive something called a RhoGAM shot around 28 weeks. It's also recommended to get the Tdap vaccine about this time. Tdap is the tetanus, diphtheria, and pertussis vaccine, and we give it in pregnancy because newborns can't get their own Tdap until about 2 months. And until then, they're at the highest risk for a severe illness, hospitalization, or death from pertussis, which is known as whooping cough. A Tdap shot during pregnancy, usually around 27 to 36 weeks, floods your blood with pertussis antibodies right when the placenta is transferring the most to your baby, giving protection through those vulnerable first weeks. You might also want to consider anybody else who's going to be around the baby and hasn't had a Tdap before. Think partners, grandparents, and caregivers. As promised, I wanted to give you a question that you can ask your medical provider that will give you something actionable that you can do. What you can ask is, based on my chart today, is there anything that you want me to do differently before the next visit? One question, one action, and less worry for you. If you like this video, give it a thumbs up. Remember to subscribe to Diane in the Pink. And if you want to join my community of like-minded pregnant women and new mamas, make sure to click the link in the video description to join my Own My Birth community. It is free, and remember that the more expecting mamas and new mamas that join this community, the more support there will be for everybody. Join now, and if you want to see a more detailed look at what pregnancy is, week by week, I will link to my playlist right here. Go find the week that you are at, and I will see you over there.